Today we're talking about acne. Now, first, before you go, oh, I've seen all these, there's bazillions of videos. No creams, no prescription drugs, no lotions. This is all about fixing acne from the inside. This is something, if we do this right, the acne should go away. So I'm going to give you some information and hopefully it'll help solve the problem. Acne is basically a transitional thing, okay? Especially for teenagers. You've got, you notice when the hormones start acting up in puberty and in early teenage years, the follicles are changing. And as they do that, as they start to grow hair, right, they start acting dysfunctionally for a while. The oil gets trapped, people get infections, and hence acne. So you can deal with it from the outside. You can try and get rid of all the oils, you can try and cleanse everything, making sure everything's good, and that will make a difference. What I'm going to tell you, there is other things to be done, okay? So what is acne? There's several ways the body eliminates stuff. The body eliminates stuff through the kidneys, through the feces, through sweat, through breathing. It does it through our pores as well. Okay, we release toxins through our pores, okay? And when we do that, there's a risk that something toxic could inflame our skin. In the case of acne, there are stuff that's food or other things that we have in our system that our body's trying to get rid of, or antibodies or different things. And as they go through the skin, they inflame the skin or cause an infection or a blockage. So what I'm telling you we want to do is we want to deal with those things from inside. We're talking about mainly three different things to deal with. One, food allergies. Usually people, when they do meats, they do veggies, and to a certain degree fruits, they don't have a problem with the acne flaring up. So I usually tell people, like, start there and try and get rid of a bunch of things. Go for a month and see how much does that clear up my face. The second one that we always talk about with regards to acne is yeast overgrowth. Now, in your intestines, you have a normal bacteria, you have normal flora. You hear of people taking probiotics. These are just basically bacteria. You have a certain amount of E. coli, lactobacillus, bifidobacteria. You even have streptococcus in your gastrointestinal, in your large intestine. It's basically your body's septic system, okay? There's also some things called yeast. Usually that's called Candida albicans or Candida, right? And so some people call it Candida, whatever, I don't care. I don't care. You can do whatever you want. Call it whatever you want. You're not talking to me. We're not having a conversation, so it's me talking to you. Do what you want. So here's the thing. But that yeast overgrowth will happen in your gut. Now, not in your stomach, not usually in your small intestine, sometimes in the small intestine, but mostly in the large intestine, okay? And when it sets up house in there, there's a certain number that's fine. But as soon as it starts to overgrow, that means we have way higher percentage of yeast compared to other bacteria, healthy bacteria. It's kind of like having a lawn, right? When the lawn grows thick and lush, how much clover and dandelions and thistle are in your yard? That tells you how healthy your yard is. Same thing happens in your large intestine. This tells you how thick and rich and good your intestines are. When there's a yeast overgrowth, we want to do two things. One is we want to get rid of some of the yeast, right? And two, we want to add some probiotic into the mix. We have food, we have yeast, and the last one is nutrition. People do use vitamin A, like retinoic acid, as one of the solutions for acne. So here's what we want to do. We want to use vitamin A in a semi-higher dose, not crazy high dose, but maybe 50 to 100,000. Now, you don't want to do this long term. You want to do this as a healing thing and then draw it back. Usually at somewhere between 25,000 and 30,000, as long as you're not pregnant. That should be a safe level of vitamin A. The other one is zinc. Is it really helpful? Because zinc's involved in healing. It's all involved in the immune system. It's also really good for skin. I like vitamin E for topical pimples that are already there and you're trying to get them to heal. You can just use a little circle band-aid and put a little vitamin E on the little on the little pad in the middle and stick that on. And the vitamin E should help reduce scarring, and that's always a big deal for people that have really bad acne, is the scarring. Some people, fried foods bother them, and if that's less typical, and if that's you, then sometimes there's a gallbladder problem where the body's releasing fats through the skin instead of through the GI tract. That can be an issue. That's somewhat rare. Do I ever need to treat with antibiotics? Almost never. Do antibiotics work? They do, but how long you got to stay on antibiotics for, and guess what you're doing? You're creating more yeast infections because you're killing off, quote unquote, the grass, right? And allowing more open areas for weeds to grow in. Your bacteria in your colon are susceptible to the antibiotic, but your yeast are not. So guess what's going to happen? The percentage of your yeast is going to get even higher. This is Dr. Michael Berglund. Today, the topic was acne. And I know you're happy to see me back. I'm happy to see you too. Let other people know. Share this on Facebook, share this on Twitter, and let other people know that are going on, and encourage them to be subscribers. We're going to kick out a bunch more videos for you so you can learn more about health and wellness. This is Dr. Michael Berglund. Have a great day.